Now on 4, it's time for another ward round at Jimmy's.
At Europe's largest teaching hospital, St. James's in Leeds, the stories continue. Medical student Joanne Waller prepares for final exams. Fiona Large and Sheila Metcalf are getting close to the day their triplets are born. Paul Hutchinson waits on the ward for his corneal graft operation. 88-year-old Maurice Pyra is taken on a home visit. 8-year-old Sarah Lattimore recovers from cranial surgery, and Robert Kennedy returns to hospital for his varicose veins operation.
Excuse me, it's Robert Kennedy. I'm been admitted this morning.
Okay, love. I'll just show you to your bed.
Right.
Okay. There you are. If you just take a seat and I'll
Right.
just get some details off you. Right then.
Yep.
Whoa. Right then, it's a lovely morning, isn't it?
It is. Yep.
Okay. Right, I believe he was in a couple of weeks ago.
Yep.
And it was cancelled.
Yeah, for the third time. So
Third
if it's
time.
yeah, so if it's not going to be a fourth timer.
No, it won't be fourth time though.
Oh.
And how long have you had your varicose veins?
Off about 4 years, 5 years.
It's all been explained to you.
Yes.
That you're going to have where you have a little cut and
Yeah.
larger cuts.
Yeah, it's all been explained.
Right. Well, welcome to ICE. Right, we've got 28 days to turn you into ophthalmologists, and after the end of that period, you probably will go into a steady decline until you retire at 65. So, although it's not the most vital of specialities, it's very important that during this assigned period, you actually come to grips with eyes. How many people have ophthalmoscopes? only one rich man. Well, that's a bit like going to play golf without clubs, I suppose. So we can lend you a couple, and we'd like to see them back at the end of the session because they're a bit expensive to keep replacing. Ophthalmology is like everything else. The most important thing to do is to make a diagnosis. No diagnosis means no management. When it comes to examining the eye, everybody knows it's just an ophthalmoscope. Most people look in, sway backwards and forwards, bit of prayer, and hope that the eye comes into focus. And that works for a lot of people, but it doesn't always work. And if it doesn't work, then you've got to know how to use a ophthalmoscope properly.
They're really moving now. I don't know how true it is or whether it's an old wives' tale, but there's girls and boys have different heartbeats. No. Is that not true?
No. There's nothing that we know of. The heart rates are higher when the babies are premature, and they gradually come down. An adult has a heart rate of 80, and a baby has a heart rate at the time of birth around about 110, 120.
When will the decision be made then as to when the caesarean section will actually be taken? Will you sort of assess that just in 2 weeks and then 2 weeks again?
Exactly, yes. But I think it's important to know now that Sheila might be delivered earlier than you are. You know, I hope that I'll get it at least as far as 34 weeks. And we'll try and stagger them, and so that the neonatal unit is better prepared as well.
Not too long staggered.
So do you want to have a go? You've all got ophthalmoscopes now.
Yeah, like that. Okay.
Keep it round a bit. You're using the wrong eye. It's the right eye for the patient's right eye. Yeah. The right hand should be the one you write with. Okay? Right.
Right.
That's super. 45 degrees from the side. That's it. That's it.
Yeah.
Finger. Go right in. Shines at her pituitary.
We know that the first triplet is small,
Yeah.
The growth rate is there, and you can see it for yourself. So we're very happy that it's growing. But the babies should have a very good chance of survival. They should be decent body weights. Okay.
Right. That's quite
And
good. Really.
if the smaller one showed any signs of abnormality in the heart race, then we would have to take a decision to deliver that day. But apart from that, I don't really expect. I mean, the babies, the traces score 10 out of 10. They're excellent.
It's just the weight. It's getting heavier now. It's getting harder to sleep at night. I'm waking up a lot more.
All right.
5 o'clock I was up this morning.
Right. I'm going to ask Dr. Lyons, who's the consultant anaesthetist for the labour ward, to see you at some point as well. Now that we're coming nearer to the time of delivery, I think it's better to get introduced to him, and so that you're familiar with him, and when the time comes for delivery, you know what's happening. He can explain to you how he.
Will you be doing the operation, or will you'll be doing it yourself? Right. Doesn't really know.
Whereabouts?
Hey, Sarah.
Hiya. Hello,
Emma.
Emma.
Sit down.
Can I come sit on my knee? She's better now.
Better now. Look, there's some bags
Sit on
in
my
it.
knee. Oh, dear. Should be like
Daddy,
this out
Sarah.
where,
Come
is
close
it?
this morning. Madam,
Oh, it should be like this out where, is it
just come now.
just...
Are you alright
Do it after.
now? Hey?
Do it after.
Are you alright?
Yeah, I'm fine.
Give it a bath.
Yeah, what's your hair?
Hey, what's your hair?
on that.
Well, that's a bit better.
I'm getting a bit bad here.
We're getting a bit bad.
Right now.
Yeah, she's alright now.
Good. Like your dress, it's nice, isn't it?
Oh, they've been saving this to put on to come and see Sarah, haven't you?
I want to put the black and white one on.
Well, that's your party dress.
Come in. Hi, Rose.
Hello, David.
How are you?
I'm fine. And you?
Yeah, fine. How was the exam?
Terrible. Absolutely awful.
Right, where are we going?
I thought we'd go around 9, 8, delivery unit, 6, 7, and then perhaps if you've time for a cup of tea with the sisters.
Fine. Okay.
Is that all right?
Good, yeah. I'm just reading a paper on the ideas for medical oncology.
What did you think?
All right, love. Lovely.
Tell him to keep them on.
Lovely. No, okay. Hey? Come on,
Hello.
No, then, okay.
No. Okay, Maurice, I'll move this. Right, just slowly does it.
It'll I do. That's good.
Okay.
Well, where we
If
going?
you take us to the lounge and show us the seat you like to sit in.
Eh?
Show us your favourite seat.
Yeah.
Yeah, then.
How are you? Oh,
All right, thanks to you.
Hey, grand to get home, lass.
He told us.
Grand to get home.
True.
Do you want to take a seat, Maurice?
All right.
Oh,
I was getting upset.
all right. Sit down, have a sit.
God.
Is this where you sleep normally?
Yes, this is where I sleep.
Right. Now, do you know what we're expecting to do today?
Expecting to do? Oh, I have no idea, lass.
See how you get around and see you can get on and off your bed and your chair and your toilet, everything you normally need to do. Try lying down and then we'll get up again. Check you don't get stuck.
I'm sure I'll do that. a long job.
His favourite
All
place.
right now.
Right, well get up again now.
Well, then help me.
Up. Not too fast.
Oh,
Just in your
there you
own
are.
time.
Up. Oh, then what? You wouldn't like me to do a somersault, would you?
No, not today.
One of the things that struck me about the Jimmy's Charter and also the Patients Charter is that it might be seen to set standards from above. I was wondering what you thought of the process that's going on in nursing, of nurses setting standards on the wards for the wards themselves.
I think that having produced those standards, the minimum standards, we now want to give the service, and that means in particular the people working at ward and departmental level, the opportunity to develop those standards. That's when I think it'll have credibility as far as people like you are concerned. And this year is about delivering that in a way that gives it credibility. If you talk to patients on the ward about the things that they remember, I mean, often the medical and nursing care, the fact that that'll be of high quality is taken for granted. But the things that they remember are things about the food. The food was cold. The custard was over the potatoes instead of the gravy. We're more concerned with the more difficult and professional issues, you know, the quality of nursing care and the quality of medical care and so on. And sometimes we don't stop to think, I mean, this is tatty, it needs putting right. Okay. Anything else?
Will you be applying for the post of Chief Executive?
Yes. I will. I thought that might come up. I clearly will. I've had the opportunity to act as Chief Executive since Ian Donaghy decided to go at the beginning of February, and I want the job. I want to stay at St James's. The interviews are at the end of the month. We'll see what happens, but clearly it's a job that has to be filled in open competition. It's important that happens. So, yeah, I'll be applying for the job, and you'll hear the outcome from me if I get it, and from others if I don't.
Okay, well done.
Uh-oh. Lost my cornea then. Right, let's not forget that. Okay.
And check the age of the donor. It should be a young cornea because it's a young patient. We'd have a problem if they sent us an empty bottle. Yep, got the cornea here.
The 32-year-old donor, a good cell count, very high cell density.
That was donated after a road traffic accident.
It was yes, secondary to a road traffic accident.
Right. Okay. Fine. Let's go.
Hi, Sarah. Nice to see you. Can I pinch your seat a minute? Are you Emma? Is that your name? My name's Eileen. And I've been talking to Sarah, haven't I? I'm the counsellor. I've been chatting away to Sarah and your mum and dad. I haven't met you before, have I?
No.
You're looking much better than you did a few days ago. Are there any bits that hurt?
My head where staplers are, hurts there. When it itches, I can't itch it.
Yeah, so it doesn't hurt, it's not a lot of pain, it just feels a bit itchy, does it?
Yeah.
Because remember when we were chatting first of all, and you said you were a bit worried about the pain and that sort of thing. Was it very painful, or was it?
Just sometimes after the operation it was painful, but now it's not so painful.
So it's much better now, is it?
Yeah.
How have you been?
Sarah's caught better than me.
Has she?
She's never cried.
Yeah.
Not cried once.
She's been very brave, hasn't she?
I've done it for her.
Are you part of a doctor, do you? Like, help them?
Yeah, I work with, you know Mr. Batchelor, don't you?
Yeah.
You've chatted to him, and I work with him. And my job is to help people like you and your mum and your dad and other people when they come into hospital and they have operations. The surgeon does the operation and I do some of the other things.
Yeah.
So I do a lot of work with Mr. Batchelor.
Do you do checkups like that?
I check up to check how you are feeling. I mean, if you'd been very upset and hadn't wanted this operation, then I would have done that checkup, and I'd have said, oh, perhaps we should leave it a little while or something, you know? I check up to check that you're all right and your mum and dad are all right. So, and that's what I'll be doing. I'll be coming and checking up on you tomorrow and seeing how you are, and just checking that you're all right.
Yeah.
That's fine, thanks.
Right, that's in quite good focus, I think, on the tummy. At this stage, what I like to do is to drill out the donor. Right, that's one beautiful blade.
Right.
That's the donor cornea, which looks very nice. Just going to punch out a central disc. Straight down and through. Right. That was easy. And just to make sure the disc is there, okay?